Do you sometimes feel sad or have the blues? This is normal and a part of everyday living. It's also normal to feel depressed after a loved one dies or after a serious illness diagnosis. We may cry, have trouble sleeping, or lose our appetite. But what's not normal is to feel this way for long periods of time. Depression is a mood disorder that affects how you feel and think and how you manage daily activities. Depression can happen at any time in your life. Major depression can affect more than your mood. For example, you might be sleeping a lot or not sleeping enough. You could lose weight or gain weight and generally lose interest in your life. You may even have thoughts about your own death. Sometimes, depression happens when a person has other serious conditions, like cancer, heart disease, or PTSD. Also, a person may be abusing drugs or alcohol, or withdrawing from them, and could also be suffering from depression. It's important that veterans seen at VA facilities are screened every year for depression. Depression can be difficult to diagnose, especially when a person has a tough time talking about their feelings. It can be a sensitive topic to bring up with a healthcare provider. However, sometimes a spouse or partner will mention their loved one is having trouble sleeping and is grouchy all the time. With these symptoms, there's often a problem with depression going on too. Some other signs and symptoms of depression may include feeling anxious or having an empty mood that won't go away, feeling hopeless or worthless, losing interest in hobbies or activities you once enjoyed, feeling aches or pains that don't have a clear cause, even after they've been treated. The good news is that depression can be treated successfully, so you can return to feeling more like yourself. If you are a veteran enrolled in VA healthcare and you or your loved one suspects you may have depression, contact your VA primary care provider, a patient-aligned care team member, or a mental health professional for help. If you are diagnosed with depression, your treatment may include medication and psychotherapy, which is also called cognitive behavior therapy, or a combination of both. Psychotherapy helps by teaching you new ways of thinking and behaving, and changing habits that can add to your depression. People usually do best when they receive both kinds of treatment. Gradually, with proper treatment, you'll start to feel better. During this time, continue to do things you enjoy, but go easy on yourself. Be active and be with other people. Get good rest. Eat at regular times. Ask for help from your family, friends, and your healthcare team. Put off making any major life decisions until you feel better. Remember, don't use alcohol or drugs that are not prescribed to you because they can make your depression worse and harder to treat. If you are concerned about a loved one who is talking about suicide or death, always take them seriously. If they refuse to get help for them anyway. Call the Veterans Crisis Line. It's a confidential, toll-free hotline, online chat or text. It's available 24 hours a day, 7 days a week, 365 days a year. Veterans or their loved ones can call 1-800-273-8255 and press 1, or text a message to 838-255 to get immediate help and support. Or to have an online chat, visit www.veteranscrisisline.net. Do you have more questions about depression and how to cope with it? Talk with your VA healthcare team. Or you can visit www.mentalhealth.va.gov/depression. There, you can find out about many programs and services to help. Remember, depression can be treated. If you think you have depression, seek help. The VA wants you to have the best care possible so you can get back to feeling like yourself again.